When you think about the dangers in a hospital, your mind probably goes to surgery or some scary disease. But what if I told you one of the biggest threats is something much, much simpler? A fall. And what if I told you there's a clever, almost hidden system working around the clock to stop it from ever happening?
Yeah, you've seen these, right? That yellow wristband. It seems so simple, but it's not just a label. Think of it as a shield. It's the first line of defense in protecting a patient from a potentially devastating injury.
So that begs the question, right? How do they know? It's not just a gut feeling. There's actually a really smart, systematic tool that nurses use to, well, kind of predict the future and figure out who's most at risk.
And that tool is called the Morse fall scale. It's this finely tuned instrument designed to turn simple observations into life-saving actions. So what is it exactly? Well, you can think of the MFS as a fall forecaster. It's a quick and simple checklist that gives healthcare workers a score, a number that tells them just how likely a patient is to fall. And here's the thing, this is not a one-and-done kind of deal. A patient's condition can change on a dime. That's why this assessment is done at least once a day, and really anytime something about the patient changes. It's all about constant, vigilant protection. The whole scale is built on 6 key factors. I like to think of them as 6 clues that a nurse, like a detective, looks for to solve the puzzle of a patient's fall risk. Let's break them down. Okay, first up, and this one's a biggie, history. Has the patient fallen recently? If the answer is no, great, that's a 0. But if they've taken a tumble anytime in the last 3 months or even during this hospital stay, bam, that's an immediate 25 points. It's the single highest score on the scale for a reason. Past behavior is a huge predictor of future risk. Next, what else is going on with the patient? Are they just dealing with one thing, or are they juggling multiple medical issues? If it's just one, that's a 0. But if they have more than one diagnosis, that adds 15 points. And that makes sense, right? Multiple health problems can really mess with your strength, your balance, everything. Clue number 3 is all about how they get around. The official term is ambulatory aid, which is basically just a way of asking, does this person need help to walk? And the way this is scored is really telling. If someone's on bed rest or can walk around just fine, no problem, that's a 0. If they use a cane or a walker, that's 15 points. But look at that last one, grabbing onto furniture to stay upright. That scores a whopping 30 points. It's a massive red flag that someone is really unstable on their feet. Okay, clue number 4 is about all the stuff they might be attached to. Do they have an IV line? Are they hooked up to any equipment? If they are, that's an automatic 20 points. It's just a simple tripping hazard, right? All those tubes and wires are so easy to get tangled in, especially if you're already a bit shaky. The 5th clue is what's called gait, which is really just a fancy word for how a person walks. A nurse can tell a lot just by watching. A normal, confident walk with their head up, 0 points. A weak gait, maybe they're a little stooped over or shuffling, that's 10 points. But an impaired gait, with their head down, grabbing for things, that's 20 points. It's a direct visual sign of instability. And the final clue, this one is all in the mind. It's about self-awareness. The nurse will ask something simple like, hey, can you get to the bathroom by yourself? If the patient knows their limits and says, no, I need help, they get 0 points. But if they overestimate what they can do, or they're just forgetful, that's 15 points. And this is so important because the patient who doesn't recognize their own risk is way more likely to take one. So, those are our 6 clues. Now, let's put it all together and see how this amazing system works in practice. We'll run through a quick example with a hypothetical patient. Okay, so let's imagine a patient. They actually had a fall at home just before they came to the hospital. They're being treated for 2 different things, and they use a walker to get around. They're also hooked up to an IV, and the nurse has noticed their walk is pretty weak. And on top of all that, they kind of think they're stronger than they really are. All right, let's do the math here. That recent fall, that's a big one, 25 points. The 2 diagnosis adds another 15. Using a walker, that's 15 more. The IV line is a serious trip hazard, so add 20 points for that. Their weak gait gets them 10. And finally, that tendency to forget their limits adds another 15 points. So you add all of that up, and our patient's total Morse fall scale score comes to 100. It's a nice round number, but what does it actually mean?
Well, a score of 100 puts this patient firmly in the high-risk category. Anything over 45 is considered high risk. So this isn't just some number on a chart. A score like this immediately triggers a very specific, proactive plan of action.
Because look, the score itself doesn't stop a fall. The real power here is how it guides the entire healthcare team to create a safety plan that's personalized to that specific patient's needs. And this is where the magic really happens. Every single risk we just identified gets its own intervention. That history of falling, the whole team gets an alert. They use a walker, well, you better believe that walker is always going to be right by the bedside. Their gait is weak, they get help every single time they get out of bed. And because they forget their limits, maybe a bed alarm is used, or the family is asked to stay close. It's a targeted, proactive plan. So you can see this whole thing is about so much more than just coming up with a number and putting a yellow band on someone's wrist.
And this quote just nails it. The true purpose of the Morse fall scale isn't just to label someone a fall risk. It's to understand why. It's a diagnostic tool that helps the team pinpoint the exact reasons a patient is unstable so they can build a precise, effective shield of protection around them.
The Morse fall scale is such a beautiful example of one of these proactive, data-driven systems that's designed to stop harm before it can even happen. It kind of makes you wonder, doesn't it? What other invisible systems are quietly working all around us every single day to keep us safe?